Okay, now this is on at the bottom of the agenda that I developed for this training, and it brings us back to one thing that somebody said along the way in the previous discussion, which is, oh, I think it was Scarlett talking about um, short versus medium term versus long term outcomes. And I think that was a really important point, which is highlighted in this flow. And so you can see here um, that the way that the logical flow works is described at the top in these gray boxes. And then in the green boxes of various green shades of green, it takes us from the assumptions to the planned work to the intended results and ultimately to the impact. And then down below that are the boxes included and some of the considerations that you need to have. And here under outcomes, um, you have some consideration that specifies, are you talking about short-term incomes, like impacts you're going to have within a year, or are you going to be talking about medium-term income outcomes? And it's good to delineate that. I also would say that that when developing your program plan on paper, that like somebody observed, and I'm afraid I can't remember who that person was right now, but I think it was, again, it might have been Scarlett, like, or somebody said like they like the thought bubbles and that one slide that I shared with you guys, and how that can kind of quickly encapsulate like the thinking behind the project. And like I said, I like to see a program proposal or a program plan that has both a schematic like that, as well as the log frame matrix or the objectives tree. And all of these different visuals appeal to different listeners. And so, for instance, when we were making the presentation to HCSC, we were trying to quickly describe a huge grant proposal with a lot of moving parts, which was like pages and pages that the funders had to page through and try and figure out what we were really planning on doing. And it wasn't until they saw the slide that did have all the thought bubbles and all of the bits and bobs that I showed you guys that, you know, multiple people in the room were like, oh, okay, now I get it. And I think that that is something that really stuck with me, because it made me realize how different learners are visual. Other ones take it in from tabular, you know, or tables. Other people like text. Most people like a schematic like that in my experience. And so they can be really useful. Okay, I'm gonna now go back over to my slides here, objectives. So are you seeing the full slide on the screen, Emily? Okay, excellent. I'm looking at two different screens, so I just want to be sure you're seeing the right one. Okay, so next up is step 8, which is identification of your objectives, and step 9, which is choosing your indicators or your metrics. Okay, so when we talk about analysis of objectives, we're going to go back to our problem tree. And what we do in this step is turn your problem tree into an objectives tree by restating problems as objectives. So basically, you're restating what was a problem statement into a positive statement. Like, no one knows what public health is. That's a problem statement. And we can translate that into a new statement, which is a positive statement that says, we will educate our partners about public health by doing XYZ. So that's an example, very simple one, but an example of how you go from a problem tree into an objectives tree. And again, you read it from the bottom up. The top of the tree is the end that is desired, and the lower levels are the means to achieving that end. Now, one of the things that we hear a lot about in program planning and evaluation is the choice of SMART objectives. And SMART is another acronym like SWOT that you see out there. And SMART stands for specific. It states what you'll do, uses action words. Measurable, it provides a way to evaluate or measure. It's achievable. In other words, it's within your scope. You can achieve it with the number of staff that you have on your team. And it's possible to accomplish in the sense that, like, financially, it's not too big, or time taken is not going to be too long. Relevant, it makes sense within the function. And it improves, in this case, in this graphic, this is more of a business application, but improves the work in some way, or the understanding of the work in some way, and then time bound. So it these kinds of metrics are, you can easily kind of put them in a time frame, like within which you will be completing the task of measurement. So right here we have the objectives tree. And so this is going back to our COVID-19 testing example that I developed for the seminar or webinar. And so on the bottom, the means are COVID education, COVID testing centers, and affordable COVID testing. Those are the means that you need. These lead into the identification of COVID infected individuals and the initiation of contact tracing. And that ends up at the goal, or the higher level, top of the tree, transmission of coronavirus or COVID is contained. So you can see there that the problem tree that I shared with you previously has now been restated into a series of positive statements that state not just what problem it is that you're targeting in your program planning, but positive statements about how you're going to address that problem. Okay, so what I want to segue into next, you can see on our program that the second half of our time together today is transitioning us through step 7, the logic model, or the theory of change. Steps us from program planning over into program evaluation. So program evaluation in history is really interesting, and it has a long history in this country. And the context that it originally evolved in was actually a business setting and a corporate setting in the 1930s at a utility company. And so that's where it kind of got its start. And the call for program evaluation has really waxed and waned over the decades, depending in part upon politics. And so, a lot of funding comes through political mechanisms or politically governed mechanisms, like federal funding, and legislatures of different stripes and educational backgrounds have advocated more strongly or less strongly over the years for good evaluation. And so currently we're in a phase with a very heavy emphasis on evaluation. So what I love to tell my students is it's a growth industry. And if you want to get a job, that focusing on evaluation could be a good idea, because there's lots of need for it. So usually we see assessment in the evaluation world occurring across 5 domains. What is the need for the program? What is the design of the program? How did execution look? And then what was its impact on the problem targeted? And how efficiently was that impact achieved? Efficiency can be measured in a variety of ways, but typically cost efficiencies are investigated, time efficiencies are investigated, and then sometimes some other efficiencies like is the change sustainable, and did it come at any sort of a social or cultural cost to the community members that were the supposed beneficiaries? Practically speaking, evaluation can pose some challenges. Partly, as I've said in here already today, the circumstances around a project can change, and they usually do. I've almost never seen no change, especially over a 3+ year project. Also, there can be like some tensions between scientific and pragmatic considerations. Like, for instance, the gold standard is the RCT, or the randomized controlled trial, in terms of research design of an evaluation of a program and its consequences. But RCTs are not, they're very expensive and they can take a lot of time. So typically speaking, those are not feasible or ethical. And so study design or research design in evaluation does frequently tend to stray considerably from an RCT or randomized control trial approach. And it's much more likely that you would see a case control study or a baseline and follow-up, or pre and post testing, and that kind of study design. We also are always functioning under budgetary constraints. People never want to allocate money for evaluation, or traditionally haven't wanted to. It's considered to be like a back office cost that should be borne by the implementing people. And thankfully, that's really changed over the last sort of decade or so. Now it's not only considered to be, not like a kind of like buried cost that somebody else should have to pay for. It's considered to be a main project cost. If it does not appear in the budget, then funders will look askance. There's a big importance of asking the right question. So for instance, all evaluations have got to be clear on the difference between outputs and outcomes. Like I said before, outputs are like lower level, like widgets, like bits and bobs that get executed, and outcomes are higher level changes that result from enacting or implementing those outputs. But how to frame questions to get at these two very different things within time and ethical and budgetary constraints becomes the challenge. So I mentioned before, a lot of the work that I'm engaged in is international, and in the sub-Saharan African context is usually malarial places. And so a funny example of this that we frequently talk about in the evaluation world is the bed net distribution efforts that people make. And so for instance, like I said before, sometimes project evaluations are aimed at an output level. Now, LogFrame bumps us over into, moving away from outputs, which are like activities, and toward outcomes, which are how did you move the dial on the disease process you were supposedly affecting. But many projects that in previous days didn't use a LogFrame approach or use it improperly in the current day, they're so focused on evaluating project activities that they miss the big picture. So like I was saying before, like you might distribute in a particular municipality or village or whatever, 50,000 bed nets, but the question is, are those bed nets being properly used or not? I mean, you're just distributing them. And if that's all you're counting, if that's your metric, number of bed nets distributed, then you're only capturing that. You're not answering any questions at all about how those bed nets are used, and how the usage of those bed nets might or might not have played a role in reducing rates of malaria. Now, if you think about all of the different things out there in the world that can affect the prevalence of malaria, then, as soon as you pan out a little bit and have that conversation with yourself, you will quickly understand that the problem is that there are a lot of different things that affect malaria rates. It could be like the climate dried out a little bit and weather wasn't conducive to the breeding grounds for malaria, for the particular kind of mosquito that carries malaria, the Anopheles mosquito. And so misattribution, as I said at the beginning of my remarks, commonly occurs when you you define your problem and your way of measuring progress toward it improperly. And so the pictures at the left bottom are pictures of how bed nets are typically used in round Ugandan homes, where the bed net is made for a square bed. So they can't fit in the structure, and people don't use them for the intended purpose. Instead, they use them to go fishing or for a bridal veil. And those are very common usages, and they work very well for those things too. And so to local people, that seems like a good idea because they don't do anything. You can't use them properly. There's all kinds of gaps and things like that when you live in a round house. And the bed net is made for a square bed or, rectangular bed. So that brings me to my next point, which is that metrics that are simple or easy are usually inadequate. And so you should constantly be looking not that you can't have any metrics that are simple or easy, because that's your monitoring side, but you still have your evaluation side, which is slightly different. And I'll come to that in a sec. So this cartoon always cracks me up, where it says answer is simple but wrong, and everyone's walking off the edge of the cliff, and then complex but right, and barely anyone takes that path. So the other thing is that programs that are actually easily measured with simple metrics are often the result of an oversimplified problem. And so we see this in international health or global health world, and definitely as well in programs in rural and frontier Montana communities, where there's like this tension between selective and comprehensive primary health care approaches or vaccine programs. Like some programs are very simple and address only one component of a broader health scenario, like a vaccine program or vitamin D supplementation or something like that. No, those programs are great, but they are very targeted, and they don't shift the needle on, you know, the backdrop to poor health in communities. Now, the backdrop problem is more of a social determinants of health or comprehensive primary health approach, but that's the subject of a whole other conversation. Now, some people feel like when they're doing evaluation of others, or someone else is coming to do an evaluation of you, that it feels like an audit, and like audit as in like you're having your taxes audited, coming from the financial world. And it should never be allowed to develop in that direction, because if evaluation is a goal of the project planning that's built in from the very beginning, the very earliest days of program planning, then it's just understood by all team members to be like a natural result of doing the work. It's like you use your blinker when you drive. You evaluate your programs if you're involved in public health. It's just something that happens, and it's best practice. And so unfortunately, there is still to this day, you know, some tension in between M&E people, monitoring and evaluation people, and program implementers, just because it can feel a little bit, it can make people feel a little bit defensive, like they'll be found to be wanting, or they will be found to have come up short. And people don't like that, obviously. And so the workaround for that is to involve everyone in the development of the evaluation plan from day one of the program planning. Also recognizing stakeholders sometimes or usually have competing priorities, and so evaluation feels different to everyone. And this leads to a sort of a tension between in-house versus outsourcing M&E. And as many people on here probably know, there are whole consulting firms that just do monitoring and evaluation, and you can hire them to come in. That sets up for a very different relationship than if you're doing your own evaluation. Doing your own evaluation is considered to be not as good because you're not objective, but bringing somebody in from the outside can be more expensive, both in time and money, because you have to spend a lot of time inducting them to the program and explaining all the things. And obviously financially they travel or whatever, and it just ups the budget some. You have to be careful in doing your evaluation. One thing that I find is that you don't create or generate data that nobody uses. And this is a very common problem in all settings, global health as well as domestically. And, you know, thank goodness most is digitized these days, so it can be easily used and manipulated across, you know, settings, but not all. So there are still a lot of paper forms around the world being used, and they're used to collect data, but then nothing ever happens with it. So there are a couple other things I wanted to talk about in evaluation, which I think if you're thinking of going into program evaluation are worth considering. One is the look good and avoid blame mindset. It's simple. People want to look good and they want to avoid being associated with failure. If program components didn't go as well as they thought they would, or now your funder is breathing down your neck because you haven't done what you said you would, etc. These create tensions, conflicts, and potential for problems. And you know, added to that is the subjective interpretation of reality. So maybe there's some evaluator weakness, pre-existing beliefs or bias or imperfect information. And it highlights the critical importance of understanding evaluation literature on similar health problems, using data triangulation or mixed methods approaches whenever possible. And there I'm referring to a mix between both qualitative methods and types of data and quantitative methods or types of data to really enrich your understanding. And then building on trust. Lack of trust can invoke both the look good, avoid blame problem and the subjectivity problem. And trust can be partial or full if the in-house or outsourced evaluation team is in play, etc. And I think without trust, honest or candid behavior on both sides of evaluation, like the evaluators themselves need to be trustworthy and honest and transparent, but if you're being evaluated, same goes. So the cartoon on the right, I don't know if you can read this, it's from the New Yorker. It says, and now at this point in the meeting, I'd like to shift the blame away from me and onto someone else. So this is something that I see quite frequently as an evaluator, and it's totally normal, it's totally expectable, but it's always good to have some strategies in your back pocket for helping people not kind of get into that mindset and just, work forward productively as a team. And as I said before, like, I really think that, there are these pitfalls to evaluation, and people don't want to be scrutinized. They maybe sometimes would just flat out deny the need for an evaluation. They think, a proper evaluation would take too much time away from other work. They engage delaying tactics. They maybe seek too close of a personal relationship with evaluators and so forth. Then once the evaluation has begun, some things that I've seen happen is people might omit or distort information or give you so much information that you don't know what to do with it. Maybe introduce new data toward the end of an evaluation to try and sway your impression or findings. And at the interpretation stage, maybe deny that problems exist, downplay the importance of a problem, say like, oh, I already knew about that. That's not actually a real problem when it really is. I'm already handling that. That's beyond my control. Or sometimes what I hear a lot internationally is stuff like, well, that's Africa, you know how it is. And, or the information that you've collected is irrelevant because things have changed. So you see all of these kinds of tactics that people employ to try and, kind of squirm out from off the hot seat. And what I would want to share with this group is whether you're talking about evaluating your own work or your team members, or getting ready to present the results of an evaluation to your stakeholders or to your funder or whatever, it's a million times easier if you build your evaluation into your program planning. You know what metrics you're going to use. You can justify the use of those metrics by going back to the evidence base that you started with at Healthy People 2030 or the Public Health 3.0 overarching rubric or whatever. There are all kinds of little tricks that you can use to short circuit these kinds of problems if you just start right and have the pieces in place at the very beginning. So where does M&E fit in the program cycle, I think, is a really important question. And that cycle or program management cycle that I've pictured here, and this comes from a document that I borrowed from the UK, so that's why it's got UK spelling at the top here. But monitoring and evaluation, I would argue, like the people who develop the schematics, sits right in the middle. It plays a role in absolutely every part of the process, and that's why I keep saying that it has to be a consideration that's front of mind at the program planning stage. I've referred over the last few minutes to a distinction between monitoring on the one hand and evaluation on the other. So just to make sure that everybody's on the same page on that, monitoring is a planned and systematic process of observation that closely follows a course of activities and compares what's happening with what's expected to happen. And that's, like I said before, at the inputs and outputs level. That's your monitoring, that's your widgets, that's your bits and bobs level of, is this program unfolding like it should be, like we promised the funder, like we discussed with our stakeholders, and like we agreed on our team. Then evaluation is a little higher level. That is a process that assesses an achievement against preset criteria. And that can have a lot of different purposes or follow different methodologies, et cetera. And sometimes evaluation bleeds over into research. So evaluation is at the higher levels in the log frame matrix. So you're looking here at your outcomes and your goals or your impacts. So the idea is like, not just like I delivered this many telehealth trainings, but in addition to that, we measured among the trainees attitudinal shifts towards this particular disease process or this particular way of treating that disease. And that resulted in this shift in the way that these individuals practice or whatever. And so it is, you know, panning out, like I said before. So on the monitoring side, we have the periodic collection and review and comparing with implementation plans. This should be open to modifications, as many people have noted in here in the discussion rooms. That's absolutely key to making this a good process. The monitoring helps us identify shortcomings before it's too late, and it provides elements of analysis about why progress fell short of expectations. Every grant I'm working on now is falling short of expectations because most of the grants were written pre-COVID. And so that's like something that people are dealing with across the globe. And that's very normal and very expectable. But what's important is to talk in a very transparent and upfront way about that, about those shortcomings and what they're related to in your particular locality. So then we have evaluation on the other hand, which is that's the more systematic process determining the extent to which service needs and results have been or are being achieved, and analyze the reasons for any discrepancy, and then looking at measuring a service's relevance, efficiency, and effectiveness, and if the program's inputs and services are actually improving the quality of people's lives, which is, like, I think we could all agree, the overarching goal of public health practitioners. So evaluation can focus on different aspects, inputs, outputs, outcomes, and impacts. So I've said that a variety of different ways over the last few minutes, but this slide just kind of restates that for us to think about a little bit differently. There are, like I said before, sort of constant tensions within the field of program planning for evaluation. So part of program planning has to be about evaluation, and for evaluation, who's going to do the evaluation and what's it going to be about. And so if you have that in-house versus outsourced evaluation, there are definitely advantages and disadvantages. So these are listed here in the bullets, but I've already said most of them, so I won't walk you through that. So before you start, you have to plan your evaluation, as I'm sure you've recognized. So how it works is you have to get your the purpose of your evaluation made clear from the get-go. You have to decide what kind of evaluation or evaluations are going to be done. And typically what we see are baseline evaluations, they're also called formative evaluations, or midpoint evaluations, which are also referred to as formative. And in addition to those, summative evaluations that happen at the end. And so an evaluation team would typically be generating these kinds of reports on a regular basis. So where do we start? Where are we at mid-course? And then at the end, what all happened over the course of the grant or program? So decisions need to be made, who conducts the evaluation, and that these are all things that would go into your program plan. An important stage in this part of program planning is reviewing existing information in program documents on similar efforts in other localities, including what monitoring information they collected. And so you can usually find that in the evidence base that's provided on your program type through CDC, Healthy People 2030, or what have you. So if you want to plan a program on tobacco cessation, tobacco cessation is so common. You don't have to do very much work for planning a program evaluation, because so many of those programs have already been very adequately evaluated, and it's all there. It's ready to go. It's an out of the box kind of an evaluation scenario, and that's great. It really helps. And then obviously you have to determine what information sources are available. And sometimes if you're an external evaluator or planning to be one, you're going to have to get help describing the program from somebody internal to it. Because if you come in from the outside or you weren't part of the proposal writing process, it can take a long time to get across all the details and understand the program from a high level view. Because any one individual who you rely upon to tell you about it, they just sometimes find that they lose the forest through the trees. They're very focused on their component of the program and don't always have that high level view. So you really do need to think about, if you're an outside evaluator, getting help to describe it. Now, you have to select appropriate evaluation methods. You have to formulate evaluation questions and sub-questions and decide on the appropriate evaluation design. Like I said before, it might be an RCT, but more likely it's going to be a baseline and follow-up or a pre-test, post-test. What measurement standards are you going to employ? What indicators, and an evaluation schedule, and the evaluation's budget. All of these things should comprise fairly substantial parts of your program plan, and also grant proposal. So some sample evaluation questions, like what might stakeholders want to know, would be something that you would want to discuss with your team, like questions for program clients, questions for program staff, program managers, and funding bodies. So I think it's a good thought exercise to work through with the team. What might program clients want to know, and how would that be different from what the funding bodies want to know? These considerations would then all feed into what would be an appropriate topic, or what the appropriate topics would be for an evaluation. Now, SMART objectives can kind of translate over to SMART metrics. And so SMART metrics are metrics that are that relate directly to the processes you're trying to influence. They are metrics, and as such, they need to be derived from actual numbers. And so that will be sometimes a stretch for some program planning staff who are less quantitative in their reasoning, but usually you can bring people over the hump if you've got some quantitative folks on the team. The A stands for, in this case, accurate. R for reliable, shouldn't be indented, and T for timely. So the adage is that metrics don't get better with age. So reporting timeframes should match the urgency of the matter at hand. So, building into your evaluation plan a concrete timeline where you're reporting back as the evaluation team to other stakeholders, either within your team or your funder or other stakeholders in the community, soon enough after you've collected the information that hasn't grown stale. And that can definitely be a challenge. Definitely worth thinking about from the beginning. So I've talked a lot now about indicators or metrics. So what are those? These are standardized objective measures that allow for things like a comparison among, say, for instance, health facilities, a comparison among or between countries, a comparison, say, for instance, between different time periods, a measure of the progress toward achieving a specific program goal that comes from a specific statement of a program goal where we started, like, we plan to reduce the prevalence of this disease from 20% to 10% in this community. So that measurement of progress kind of hinges in some ways on the statement there at the beginning. Characteristics of good indicators are clarity. They're easily understandable by everybody. They're useful. They represent all of the important dimensions of performance. That's not all of the dimensions of performance. They are the ones that your team has decided are the most important ones. They obviously need to be measurable. Like I said before, they're quantitative. These are kinds of information that are typically quantitative or numeric that feed into our ability to calculate rates or proportions, percentages, generate a common denominator and identify an appropriate one like population size or what have you. Sometimes metrics are qualitative of sorts, questions that are phrased in a way that get at like what appear on the surface to be non-numerical or non-quantitative. And then indicators need also to be reliable. They need to be able to be consistently collected by different data collectors. So in that way, they need to be carefully defined. And as I've said before, the leading health indicators, the LHIs that are ID'd in Healthy People 2020, Healthy People 2030, do a lot of that work for us. In other words, they say like, okay, if you're doing tobacco cessation, these are the metrics you're going to use. This is the denominator. This is the numerator. They make it so clear for you. So I don't want you guys, if you're not kind of more epi or stats people, to feel intimidated too much by this, because you don't have to come up with a lot of these by scratch or from scratch. And also there is a validity factor, meaning the indicators are valid. They measure what we mean them to measure. Step 9 out of 10 steps is choosing indicators. Okay. So indicators demonstrate to what extent results have been achieved. They specify how the achievement of an objective can be verified or understood, and they are the foundation of a project's M&E efforts. So going back to the COVID-19 testing scenario, you can see here this 4x4 matrix that I showed you before does that exactly. And this is kind of a silly mock-up and hypothetical, and you know, it's not in use or something like that, but it just helps us see, for instance, how you can really drill down into specific indicators that are useful and also fairly easy to measure. And so those can be seen in that second column, just to bring you back to that. So that would be like, for instance, a number of sites or a number of tests run, number of positives and negatives, the per capita incidence of the disease, and the outcome might be the number of tests run increased from X in this period to Y in this other period. So like that. So it's really the second column in the log frame matrix that you're seeing the heavy emphasis on the indicators and defining them as precisely as can be. Okay, so I am going to pause for questions here. And I think I saw the chat had something in it. So let me just pop over to that. Oops.
I didn't see anything, but certainly if I missed it.
Okay, super. Right, so
do we have time?
I was just going to say, yes. The final step is checking your assumptions. And before we get to that, we're going to do a quick poll. And then we're going to let you go for a break. And then we'll ask you to feed us some information through the chat box, which I think is unfortunately probably all we'll have time for rather than another discussion. So the third poll is, would you yourself feel comfortable choosing and defining indicators or metrics for a program that you would like to plan? Second question, that's the poll. And what I had planned for the breakout Zoom room was when you were reflecting on that poll question, if there were any impediments, where were they exactly? Were those impediments in sorry, I need to move some things around on my screen here. In research design uncertainty or staffing challenges or worries about time skill set required for managing data and analysis, et cetera. Now, as I said before, the reason I'm interested in getting a little feedback from you guys here is because the more we know from you about challenges that you experience, the better we can craft our training schedule going forward. So we're gonna let you guys finish filling in this poll. All right, so the last of the 10 steps, team, is check your assumptions. And as I said to begin at the outset of our time together today, these are assumptions that we make in doing our program planning that just are natural. I mean, you know, most modeling or programming exercises rely upon a set of assumptions. There's nothing wrong with that. The only thing that we want to do is make them clear. So these describe the necessary internal and external conditions in order that have to be in place in order to ensure that activities will produce results. So another way to think about assumptions that these are is that these are risks. They can jeopardize the success of the project. Generally speaking, we like to see assumptions worded positively. In other words, they describe circumstances required to achieve certain objectives. They should be relevant and probable types of statements. And if an assumption is not important or almost certain, just don't include it. We don't need to have that in there because it's sort of stating the obvious or not important. And a killer assumption is one, like I explained at the outset, is going to just bring the whole thing down. And so I think it's good to have some conversation with our teams about killer assumptions and if they are good assumptions or not. So for instance, in one of the places where I work in Nepal, it's very earthquake prone region. And after the 2015 mega earthquake that killed almost 10,000 people in April, I guess it was 2015, almost all program planner, there was like a ripple across the program planning community and evaluation community wanting to build in a certain set of assumptions about the likelihood of another earthquake because of the sheer shock and devastation of that. And it didn't seem like it was so confronting that it seemed impossible to do any kind of program planning that didn't include some language about the likelihood of an earthquake, and the assumption of an earthquake happening again would be a killer assumption. And so it actually ended up being kind of paralyzing because, you know, it felt like something you needed to provide for, but then when you came right down to it, the likelihood of another earthquake like that happening in the next program cycle was actually pretty low, but it was very difficult for people to say that at that time. And so killer assumptions can seem very important depending on when you talk about them and end up actually not being that important. But other killer assumptions need to be identified. Like I said at the outset, if you're doing a program plan in November of an election year, you can't assume that the new administration's priorities for funding and priorities for action are going to be the same. That would be a killer assumption. Again, time bounded somewhat. Some examples of assumptions would be political ones, as I've said, economic ones, that there are adequate funds and materials, that there are adequate skilled people, that training needs are met, that you're going to get approvals and contracts with legal and administrative considerations in place, and that your stakeholders are going to participate. And so these are very worth taking the time to think about and just make sure that you include some language about them in your program planning document and your grant proposal. One of the things that I absolutely love about the 10-step log frame process is that it almost gives you the backbone of a grant proposal. You can fit it into your grant proposal narrative very nicely. And if you can include all of the different parts and you demonstrate to your readers that you've thought about your stakeholders, you've done a stakeholder analysis, you've thought through all these bits and pieces, you've developed a problem tree, an objective tree, and you put all those things in there and your assumptions are made clear, you've considered them all thoroughly, boy, will that make your proposal stand out. And it will make an impression on your reader that this team has really thought this thing through, and we feel confident that they will spend our money wisely because they're really on their game, they're thinking. And so go ahead and include this kind of language in your document. That's totally not only fine, it's I think best practice. All right. When you're doing your evaluation work, I mean, one of the things that you're going to want to do is draw some conclusions. And so this schematic is one that helps us look at things like when we determine our conclusions, are we saying that a hazard exists, that there's no hazard, if it's unknown? What are the kind of categories for those hazards to be understood based on? And then what kind of recommendations for public health actions might flow out of our the conclusions that we have drawn based on the data that we collected in our evaluation strategy. So I like this schematic. It really helps me kind of think through how I want to phrase conclusions, and that it just helps give me some structure there. So again, I'm not starting from a blank page. Maybe it's not going to translate directly into the way that you want to write your conclusions from your evaluation of your project, but it at least gives you a sort of a framework to think about going about that. When you're describing your results, you have to say we're looking at a summative evaluation. This is an evaluation that's happening at the end of the funded period. You're going to ask yourself sort of a selection of questions. What were the outcomes? You need to present data on the primary outcome measure or measures. You will want to do some comparison to a baseline if it's available, and hopefully it will be. Compare it to the goals of the project. Compare to benchmarks that are provided for you through the evidence base from, as I said before, Healthy People 2020, Healthy People 2030, or what have you. And then you want to provide data on any secondary measures that you also collected in your collection of indicators that would also support your conclusions about your program's outcomes. Then what else did you find out? Any answers to additional questions that came up as you worked your way through evaluating the program? Any other interesting findings or lessons learned? And sometimes you're going to be providing sort of anecdotal information or attitudinal change from the team members that they talked about that happened in their own understanding of the health problem and their role in fighting against it or addressing it. And we usually like to see data at least partially presented visually using graphs and figures. And graphs and figures, as many of you are very familiar, can look a lot of different ways. And some of those ways are depicted here on this slide. And, you know, most database management or software programs that we typically use, starting with Excel, will generate this kind of visualization of our data for us, like easy peasy with a couple of clicks. And so in this day and age, it's really easy to generate this kind of visual. We do have a whole class through the Public Health Training Center on research design and the management and deployment of data, which I would really encourage you to take. It's well beyond the scope of this training, but very useful refresher for people who haven't been trained on that in a while. But what I did want to talk about as an evaluator and somebody who thinks a lot about reporting data visually is to remind you to avoid chart junk or excessive data ink. Chart junk on graphs and figures that just kind of gum up the visual and don't really add anything to what you're trying to display for your reader. On your tape, on your graphics, or too much ink on your tables. So I think you'll see on the slide here that the chart at the top is really much too busy than it really needs to be. At the bottom, it's the same information. It's presented much more elegantly and gets your point across. Same with the table. I think everyone has to make decisions about how much ink they want on a table. I prefer the bottom one. To me, that looks more elegant. But some of my students and team members said, I can't read the rows across if it doesn't have a line. So some of these things I think are really, they sound sort of trivial, but they're actually really important. And I want to emphasize that because I want to bring us back to the stakeholder discussion that we had, where you have to remember in reporting on the work that you and your team did at the end, as you do the evaluation, or you're maybe giving feedback to an evaluation team that's evaluating your work, that some of the people who are going to read this don't have time to weed through complex visuals that are hard to understand or have so much going on in them that they become confusing, or tables that are too big or you can't read them across the rows or what have you. So, especially in Montana, what I found is some of our people that we're talking to, they're actually not that comfortable looking at graphs, or they're not that comfortable interpreting data which are presented in, say, like a typical logistic regression table, or with lots of equations and stuff. That doesn't come easily to them. They find it off-putting. And so I really have thought a lot about this particular point here. Like, how do I give people information in a way that they're going to absorb it? And then in your conclusions, it's typical to answer the following questions. Were the project's goals met? What key barriers were targeted? What was the most effective action and why? If the goals weren't met, did you miss some key barriers to improvement along the way as a team? Did you miss an opportunity to do a mid-course correction, and why? Maybe it was a good idea, but the barriers to implementation that you didn't anticipate were significant. So what were those, and how can they be overcome? Did you get only part way there? So you maybe changed knowledge base in your target population, but you didn't change behavior. These are all things that you want to know and acknowledge in your conclusions in your report. Did the intervention produce results on other important outcomes instead that they were unanticipated outcomes? This kind of thing. What I like to see in the report writing that comes out of an evaluation exercise is that the authors have really kind of confidently and transparently reported, these things went great, these other things didn't go so well, here's how we would do it differently in the future. I know when I read reports, when I'm doing a program plan, it really helps me to see where other people fell down, partly that I can feed that into the actual writing in my program plan, and what strategies I plan to employ to avoid those problems that other people encountered. Cite their study and demonstrate to your reader that you really educated yourself about all of the potential pitfalls and how you're going to avoid them. Now, you do the entire industry a disservice if you don't include that information in your own conclusions about evaluating your program. It disallows other people from learning from your mistakes. So, in this day and age, there's a big emphasis on transparency around mistake making. And I really think that's incredibly valuable. Last but not least, dissemination. So these reports need to go back to your original stakeholder groups and need to remind them what were the needs identified, what were the goals of the project, what were the actions undertaken. Address as best you can any additional concerns or questions that arise. And I've provided you with some phrases that might be helpful in dealing with incoming questions or concerns or even criticisms. Like maybe you could say something like, that's a good suggestion, we could try it going forward and see whether it helps. Like if you're doing a summative evaluation or formative evaluation halfway through. Well, we did try that and here's what we found. So, mirroring back to your person who's giving you the criticism, yeah, I hear what you're saying. That's a really good point. And we actually did think of that and try it. This is what happened. Or we didn't have the time or the money or experience to do that, but that's a great idea. We can explore it for the future in the next grant rewrite. Or we didn't think of that question, but we do have some data that might answer it. And last, we don't have data to answer that question, but it's a good idea for future studies. So I like these phrases because they give me the feeling when I read them of respect and mutual consideration. And I'm just envisioning here that you're discussing a report that you that has been read by one of your stakeholders, and they've come back to you and said, hey, you know, I don't understand why you did this, or why didn't you think of that, or what have you. Last is dissemination. So other than to your stakeholders, we have a duty to disseminate the work that and findings that we generate through different mechanisms to the broader community so that people can learn from the money that was spent on these projects. And I think that's like an ethical obligation to our discipline as public health practitioners, but as people who are using taxpayers' money, I also think it's an obligation. So our reporting might flow out beyond stakeholders and internal reporting to organizational newsletters or maybe summaries for patients, providers, funders, trade associations, obviously scholarly publications and research conferences. So one is MPHA, and I always like to put in a little plug for Montana Public Health Association. They just announced the dates yesterday, and I'm pretty sure I remembered it correctly. It's September 21st through 23rd. Does that sound right? Marilyn, you're nodding, yeah. And usually the proposals are due in May, and people just enjoy sharing, you know, what came out of their work and what did you learn and how can you help others? And then of course the popular press. So I think that dissemination piece is really, really important and something that we don't always budget the time for that we need to, because it does take time to write up these things, but it's all worth it in the end. Well, that is it. I feel like we've got like about 10 minutes for any questions that you guys might have, or time to fill in the evaluation for the training and that sort of thing. So I'm just trying to pull up the chat box here. Sometimes for some reason, my option to do so kind of disappears when I'm sharing my screens. Here we are.
Zoom is being finicky. Yes, certainly ask any questions, use voice or chat. In the chat box, I have put a link to our evaluation. We certainly encourage you to fill that out. It helps us continue to provide trainings to y'all, and we share the results with Kimber, and of course it's anonymous. Only takes a few minutes, so please do that. And then, yeah, the floor is open for any Kimber questions.
Yeah, I have a question. This is Joshua.
Hi, Josh.
I like the last few minutes of what you were sharing, talking about being honest and, you know, thinking about challenges or my question is, how receptive are funders and powers that be to being honest about, hey, we screwed up, or hey, we learned this, or hey, we fell short? You know, I feel like we live in a culture where, you know, we talk about success, but we don't talk about challenges too often. So
yeah, I agree with you. I would say like 15 years ago, it wouldn't, I would want to phrase it very carefully. You know, I think in this day and age, it's actually becoming quite commonplace. There are two articles that I could link people to if you just ping me by email. One came out of Stanford Business Innovation and Review, and the other one came out of Harvard. And that's from the corporate sector on admitting mistakes. But within the health and development sectors, there is also a really heavy and emerging emphasis on admitting failure. And there's a great TED Talk on this by an engineer, water and sanitation engineer whose last name is Domberger. And he worked with Engineers Without Borders. And it is one of my all-time favorite TED Talks. I always show it to my students in my global health class. And it is about his experience admitting failure. And then he started this whole like NGO, which in and of itself was dedicated to creating a space where people working in the development world, either community development and sanitation infrastructure or global health more generally, could come forward and admit their mistakes and admit their failures and allow other people to learn. So I want to say Domberger's talk is probably 7 years old now, Josh. So I think it's got, it might have kind of had its day, and it's like a little bit less out there anymore than it was like 5 or 7 years ago. But I think that's evidence that it's like almost commonplace. And I think that, I mean, everybody on this call is a public health practitioner. Oh, thanks, Trina. You guys know, like if you were reading a report that pretended that everything was hunky-dory and went great and exactly as predicted and like you would read it and you would think this feels a little disingenuous or a little unidimensional. And I think that you, like I, would value and reward a report written by people who said, these things went great and according to plan. This part required a mid-course correction. This one over here didn't go so well at all. And let us talk about why, with transparency and honesty. And what are some of the workarounds that we put into place in order to address that? And just put it out like that. I know in the work that I'm doing that's HRSA funded, they seem very comfortable with admissions of failure. And I would love to hear from other people who have any experience with that in answer to Josh's question. It's a great question.
Just so you know, there's also 2 questions, one from Marcia and one from Marilyn.
How much should be budgeted for an independent evaluator? Oh my gosh, I haven't thought about this one for a while. There is a percentage, I think it's somewhere between 10 and 15% of the total budget, Marcia. And I think that's around right. It also depends on what the research design is for the evaluation. Like I said, some study designs for evaluation are very expensive, like in RCT. There are a lot of outfits out there, especially through MIT, which are heavily into RCTs of different kinds of programs like we engage in. Those are very expensive and would need more budget, more than 10%. But I think the benchmark is between 10 and 15%. So for sort of a standard evaluation. Yeah. Okay. Question. Sorry, Emily, did you say there was another one from?
Marilyn has one up there.
Oh, thanks, Marilyn. That's a great question. Actually, I'm going to punt that over to you, Emily. Would you say Christina Barsky's course on creating meaningful metrics and measures that complement what we learned today? Because her course is on research design and data management, right?
Yeah, and I don't know when the next time is we're going to offer it. So Marilyn, I'll be in touch if one of these comes up soon. As with everyone, just certainly keep an eye on the website. We'll be adding a lot to fill out our spring and early summer in the near future. And Marilyn, I can certainly be in touch. I'm not sure when our next one will be.
I would say of the ones that we have, though, that one is the best. And Emily, what's it called again? Because I think I probably called it the wrong thing.
Let's see. Oh gosh.
Dr. Barsky.
Oh, I know where to go. I had it. I just had it up. I don't remember which one it was. I think it was data collection.
I think it is data collection, and then it has like a subtitle that has to do with research or like data management and analysis or something like that. Like I think it's all a business, and it's a long one, right? It's like a 12-hour. That
was a workshop.
Got a lot of pieces.
I'm not sure if we'll repeat the workshop, which was an overall 12-hour total, but we might be able to do it in a smaller, like 4-hour webinar like this.
Yeah, it's a big ask, you know, because there are a lot of skills that a training like that is scaffolded on top of, you know, quantitative reasoning and da 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 da. But I think that it would be you could cover a lot in 4 hours. That would get you partway where you needed to be, Marilyn.
And if you did divide it, the 12 hours into 3 days or even 3 sessions over a period of time, that might be, because it is so intense in the labor of it. I hate to have it squished up and miss something.
Oh, for sure. And that's what we
That's a
did
good
last
point.
time is we separated it.
Yeah.
Like, every Monday for 3 Mondays or something. And that,
Yeah, that was good. Yeah, I'd like to see that again.
Okay,
Thank
good
you.
to know.
And thanks so much.
Marilyn, did you go to that Dr. Barsky one?
I went to one of Dr. Barsky's. I think that was the one. I got a lot out of it.
Yeah.
And it was really good, but it's always good to like these have refreshers and really, you know, each time when you're at least in my personal opinion, each time when you guys give these, there's always a little bit of something added because you've learned something new.
Yeah.
And it's so, but the frameworks that are taught through these, I think, are really super important. It's always good to get a refresher because then you get like, oh, I could use that. Oh, on this project, I should have used this, you know.
fair enough.
Yeah, or even if it's like, for me, how my brain works, I find it very reassuring just to be told, we still do that.
Yeah,
That's still best
exactly.
practice. You know what
Yeah,
I'm saying?
that's still the way. Yes.
Yeah,
I
yeah, you're
appreciate
good.
it.
Feel confident.
Well, thank you.
Thanks, Marilyn. And Trina put in the chat something for you, Josh, about the CDC wanting to talk about barriers and challenges, not mistakes per se. But yeah, just to put you in there. I think that's it for the chat.
I feel like the CDC is particularly open during COVID to hearing about things that didn't work out and then making sure that we have plans for addressing those things, those issues in the future.
Thanks for bringing that up, Trina. That's really good feedback on where CDC is at this year, right now with the COVID. All right, well, I think that's it from my side. I don't want to keep people, it's just coming up on noon.